www.healthcmi.com. Acupuncture continuing education online today. Acupuncture beats drugs for chronic prostatitis. And we'll get into exactly what you can expect from acupuncture in eliminating this condition. Now keep in mind that this article will also help you distinguish between prostatitis and benign prostatic hyperplasia, or BPH. They're very different. Prostatitis is a term referring to prostate inflammation, usually caused by injury or infection. So bacterial infections, including in the bloodstream, which is bacteremia, epididymitis, that's a tubule in the back of the testes. When that gets inflamed, that can cause prostatitis. And risk factors include catheterization, prostate biopsy, pelvic trauma. Symptoms include painful or difficult urination, that's dysuria, frequent urination, urination at night, urgent urination, blood in the urine, painful ejaculation, pain in the groin, penis, or testicles. Prostatitis is nasty. In the acute stage, that's when someone's going to wind up at their doctor or emergency room, whatnot, and get some antibiotics, usually if it's an infection. But we're referring to chronic prostatitis. What happens when that doesn't work long term and it still persists? Now, that's very different than benign prostatic hyperplasia, because that's a different condition, and that's just when the prostate becomes enlarged with aging, typically. They're very different. Now, neither of these conditions are prostate cancer. Remember, that's a very different disorder. So let's look at this research, and again, this is limited to prostatitis. Acupuncture outperforms drugs for the treatment of chronic prostatitis. Researchers from the first affiliated hospital of Chongqing Medical University gathered objective and subjective data in a controlled clinical trial consisting of patients with chronic prostatitis. The acupuncture treatment group achieved a total effective rate of 87.5%, and the drug control group achieved a total effective rate of 62.5%. So they used some subjective and objective scoring, including electromyography, uroflow rates, and they basically found that acupuncture is superior to drug therapy. So here they used EA10 and P5 extract along with an antibiotic. That was the drug group. And then the acupuncture group received electroacupuncture therapy at 4 acupuncture points plus some special points for differential diagnostic considerations. The basic acupuncture points for the acupuncturists listening today is Guanyang, Zhongji, Suliao, and Huiyang, CV4 and 3, bladder 32 and 35. And then this article published at healthcmi.com, if you go there and click on news, the November 20 article 2018 entitled Acupuncture Beats Drugs for Prostatitis will give you the special points used for certain circumstances. The article gives a little historical context in Chinese medicine, so this has been treated for well over hundreds and hundreds of years within Chinese medicine, and the results are measured and get quantified using scientific instruments. The problem here is that the hospital medicine, the antibiotics, are very helpful in an acute situation. But what happens if this goes on and the drugs no longer get the job done and the prostatitis continues? This is certainly a time when someone needs to consider consulting with a licensed acupuncturist in their area to find answers. And this article gives a little more detail, what you can expect, what is done. It's also intended for acupuncturists. It quotes some of the ancient texts where this was first devised, this treatment protocol. And it also gives the layperson indication of what the condition is and how to resolve it and what results they should expect. So this is why this is a great article to take a look at. There's a nice pictorial there of prostatitis to take a look at how that illustration shows how this problem occurs and why it occurs. So go to healthcmi.com, take a look. Just simply click on news, and you'll learn all about prostatitis. Thank you for listening. www.healthcmi.com.